Hey everyone, it's Dr. Kimberly Evans here from Sugar Land Medical Spa. I am going to talk to you today about how to get wet AF. Now, it's important for you to know that today's topic has a lot to do with women with dryness, but I do want to let you know that every patient can be different. So sometimes you're suffering from the opposite, such as too much moisture or abnormal discharges, things like that. So I'm going to just touch on that for just a second. Before I go into the vaginal dryness, also known as vaginal atrophy. So, if you are a lady who are suffering from too much moisture, this is important for you to know. And this is something that when I look on YouTube and I see a lot of people that are commenting on this who are not even medical providers, you yourself needs to know for your own health and wellness. And I advise my people like this too. And realize again, every patient is different. So your situation may be different from someone else's, but it's important for you to know that all discharges are not created equal. So sometimes if it's too much, if it has an odor, if it has an abnormal color to it, if it comes with pain, those are all reasons to seek the attention for a medical provider. This is not the time for you to be just treating yourself with various things over the counter. And I meet women like this all the time. They come in, they're burning, they don't feel like themselves, there's abnormal lesions that are down there, and they've been self-treating themselves and they really haven't got to the actual problem. So again, that's where your medical provider comes in, and that's where what we do. So please, realize that yes, you need a nice medical provider / gynecologist on your side. Okay, I have more than 20 years of experience. I've dealt with pretty much everything. A lot of women, they can't surprise me anymore about what I've seen and things like that. It's just sometimes it really just depends on what's going on. How do we treat them the best? Okay. Another thing I advise my people, that the vagina is a delicate ecosystem. So just like in high school, if you were lucky enough to, develop one of those projects like those little terrariums where it was a delicate ecosystem between the water, which is like the moisture and the environment and the air and stuff like that, the vagina is the exact same way. And that's important that you notice that. So I usually advise my people that the vagina is also like a self-cleaning oven. So you don't have to do too much to it in order to make sure that it's functioning well. So if you use like a lot of heavy perfumes to cover up odors, if you use, put things in the vagina to help with vaginal tightness, please stop doing that. Okay, because you can only make things a little bit worse. So you really want to get to the root of the problem. So again, if you have those issues, get with your gynecologist, figure out what's going on, making sure they're doing the proper tests and things like that. Okay, good. So now what I'm going to do is I'm going to switch gears to what happens if it's too dry. Okay, too much dryness, it can lead to problems such as painful intercourse, uncomfortableness, itchiness. It just doesn't feel right. For example, when you're in your swimsuits and bathing suits and you're just sitting there and you're just doing a little dance because she's just not right. You just know that something's wrong with her. So this is for you. Okay, so I need you to know too, this is going to vary between different ages. So there's some people that we have young in their 30s who are experiencing dryness, where we have a lot of ladies, above the age of 50 that are experiencing dryness. So this is something that's important to know. So there are many causes of feeling this way. Definitely getting with your gynecologist so they can actually take a look inside there, do the proper tests, figure out what's going on would be like the first step. So you need to be seen and examined. Second thing that we're going to do is we're going to determine, okay, what is exactly going on? I've had some younger people with on birth control pills. I actually tell them to get off the pill in order to restore some of the moisture down there. Versus I had some people that were just using off-brand products. Remember, the vagina, it's skin. Skin likes to breathe. Right? So if you're wearing like leather underwear, rather than cotton underwear, letting her breathe at night, those are all the things that can lead to feeling very, very uncomfortable in those areas. Those are some of the things that can do that. So now, what about for women above the age of 40 that are actually going through changes? This is where the topic really, really gets to you, okay? So for my ladies that are 40 and above usually, but sometimes 35 and above too, your estrogen level starts to plummet. So what does that mean? That means that when it comes to having vaginal moisture issues, you're having to use a little bit more during intercourse or a little bit more TLC in order to get her to respond well, okay? So again, this is for women that are having this issue of dryness. So do know that if you're having that problem, you can use various things over the counter to start off with, like things like KY jelly. I usually advise my patients that those are great options for you. Those are great during intercourse. Just, be careful if you're using the ones that, when you blow on, they heat up. So if you can imagine, those would be some of the ones that may be a little bit less comfortable for you. So I think that the more natural products are also great options too. A lot of gynecologists, we would also recommend things like olive oil, coconut oil, things like that in order to keep her nice and moist and, carefully taken care of. Definitely, if their guys are listening, I want you to know, definitely making sure that your lady has proper warm-up time, so that may involve extra foreplay, things like that, in order to make sure that the lady is properly lubricated. And then the other thing that we have is, which I'm really excited to talk to you about, is estrogen therapy. Estrogen therapy is great for women that are experiencing vaginal dryness. This can be anything from ladies with premature ovarian failure, where they stop making estrogen early in life. This can be great for women who they just, start to go through menopause and they're like, oh my goodness, doesn't feel as well. It's taking longer and longer to have orgasms. Those are all things that can be estrogen related. So I just want to show you something that we use in our practice that really, really makes a big difference. Okay. I have it right over here. It's in this little bottle right here. And what it is our BioT pellet. And I'm going to show you how teeny tiny this little thing is. So for the ladies that think that size don't matter, oh, it does. It totally does. So with this little thing, and hopefully you can probably barely see it, but that little thing right there, that is an estrogen pellet. Okay, so with our BioT hormone balancing, we do estrogen as well as testosterone therapy. Testosterone therapy can actually help too with the vagina and help the moisture, because what that does is it actually causes vasodilation of those vessels down there. So it can make things like the clitoris more sensitive. It can actually help increase those moistures, but really the vagina loves estrogen. Okay, too little estrogen can cause things like vaginal atrophy, and that's what leads to, again, the pain, the burning, the feeling like sandpaper after intercourse, or carpet burns after intercourse. Those are common things that I talk to my patients about. So do know that our goal is to figure out what's missing with your hormone panel, figure out what we need to do in order to help make up that difference, and then certainly adjust us accordingly. So there's some ladies where they just need a little estrogen, versus I've had some ladies in their 60s where I literally had to turn down the estrogen supply simply because she was having too much moisture. I mean, great, every patient is different. They will all have their own individual needs. This is why, for example, there's many different types of, lubricants for your skin. Some of them are heavy, some of them are lighter. So some people like lotion, some people like petroleum jelly, on your skin per se. But for the vagina loves estrogen. So it's important to have a good hormone balance specialist doctor like myself, like we have certified providers also here at Sugar Land Medical Spa, in order to help you in this arena. So just remember, take care of her. The vagina is a delicate ecosystem. She doesn't need much to help her. She just needs more of the natural stuff, and you should be in great shape. If not, definitely visit your medical provider so we can certainly, give you a little bit more information. So visit us today, sugarlandmedspa.com, or feel free to give us a call. We do consultations, okay? So take care. Thank you so much for tuning in, and hopefully this will help you in your journey of experiencing more natural, beautiful moisture. Take care, everyone. Peace and love. Dr. Evans.